And we're pleased to be joined once again by Dr. Jamie Taweel, the internal medicine specialist over at Grand River Medical Associates, back with us on the MegaCast. Dr. Taweel, thanks for being with us again today.
How are we doing?
We're doing all right. The state of Michigan and our COVID-19 numbers, not so much. Currently, Michigan added 6,093 cases and 29 deaths from the virus on Monday, which of course included cases from both Saturday and Sunday. Right now, the COVID crisis in Michigan seems to be taking another hard turn in the wrong direction, and it's sustained itself for a while. It doesn't seem to look like it's going to be on the up anytime soon, because we have schools going back into session. We have a lot of debate about mask mandates and other things. What should people be more aware of right now, particularly in order to help our medical community out that has been so hard pressed throughout this pandemic, and once again, particularly in the hospital systems, is starting to get a little bit more pressure put on them because of the COVID-19 situation on top of other regular medical procedures?
Absolutely. I mean, it is pretty tragic that it's starting to creep back up again, though we're expecting this with the Delta variant as well as with the schools going back in. So, my recommendations will always remain the same, to try and do the best we can to mitigate this. Obviously, the reason we do all of this is to keep the patients safe. But at the same time, we really want to try and also not exhaust the hospital systems, because they are just getting slammed and overwhelmed. And a lot of times it's about resources. So recommended to continue. Please try to encourage people to get the vaccine. It can help reduce hospitalizations. It may not completely, prevent you from getting COVID, but it can definitely reduce your risk of hospitalizations and death. It's been proven. It's been shown. Hopefully that will be something that people will take a little bit more seriously. Not that they're not, but I do want to encourage people who don't feel that they're ready to receive the vaccine yet to give it a good second look.
We're joined by Dr. Jamie Taweel, internal medicine specialist over at Grand River Medical Associates, with us on the MegaCast. And doctor, if your patients contact you with questions about the COVID-19 pandemic, is that the right decision to make, to contact your primary care doctor? Can they usually provide enough of those answers to help people be as informed as they want to be about the COVID-19 vaccines and the ins and outs of any of these certain doses that are available in the U.S., or do you point them in directions of other resources that they can also tap into to get that information as they have their questions answered and they're asking them about these vaccines?
So, I get asked this. I'll see, a certain amount of patients per day, and almost all of them will ask me questions with regards to the vaccine. I'm very happy to answer those, as all primary care physicians should be. We're the front line between you and healthcare. So I think it's definitely a good idea to definitely bring it to the attention of your primary care to get those questions answered. If I can't answer those questions, I do point them in the right direction. It's my job to try and stay as up to date as possible on the recent data. It can be a little bit daunting, though, because people do come to me with data that's not, I get things emailed to me. I'm doing my own research. We're doing the best we can. We're getting the guidelines, and we're constantly reviewing them, and we're making sure that we're on top of things. However, when patients come to me with data that's not necessarily, CDC approved, or, I heard this or I saw this, that can sometimes be difficult because it might be a little bit out of the realm of what I'm basically looking at. But to answer your question, it is definitely a good idea to bring it to your primary care physician. We should be very well equipped to answer those questions, at least reasonably to your satisfaction.
Yeah, and beyond that, though, people do want to do some of their own research. They do want to see that information, read the information for themselves, and get some more in-depth questions answered that maybe they either don't have the time to get answered with their primary care physician when they're asking those questions, or if they have some follow-up questions or something piques their curiosity and they want to look more into it. So what should they be looking for when they are researching and they're looking for these resources, and they're looking through all these different resources that are out there on COVID-19 and on the vaccines? What should they be looking for to trigger in their heads that this is an accredited source, this is a legitimate source that has factual information, versus this might be a little bit suspicious, or it's not quite something that may be accurate?
That's a great question, because it's really hard to tell. And let me first start by saying I love when patients do independent research, and I encourage them to do so. It's always good to be empowered to take your own health into your own hands and make decisions based on the information that you get. I think it's tough because patients will oftentimes trust certain sources and may not trust even the information that I'm providing. There's been a lot of relative distrust sometimes with the recommendations that are put out by the CDC, and that's understandable given kind of the rather fast and haphazard way things went through it, because we were actively dealing with a pandemic as it was occurring rather than being ahead of it and predicting things that were going to happen and trying to get on top of it. It kind of occurred while we were doing it. I've used this example many times in the past with you guys, where I've said, it's kind of was like working on a car while we were driving it down the freeway at 80 miles an hour. It was tough to do. So it can create a little bit of discourse and a little bit of distrust, but I do think that the CDC constantly updates their recommendations. So anything from the CDC, anything from the WHO, World Health Organization, anything that is accredited by the AMA, do your research. And I do encourage patients that when you are hearing things, you are getting things, is it a study, double-blind, randomized, placebo-controlled if possible? Does it have the approval of the medical associations, the approval of the CDC, who are actively working to try and get this under better control? And ask yourself questions. Always be curious. Always be curious. I have patients that are very skeptical of the information I give them, which I'm okay with. My goal is to try and provide you information for you to make a decision, not to tell you what to do. But I also think that you should have that same critical eye towards everything you're looking at. Selectively being critical, it can sometimes be a problem. I have a lot of people that are looking for confirmation bias. In other words, they're skeptical of the vaccine for their own personal reasons. There's nothing wrong with that. I understand that completely. However, when you are looking up data, you want to look at just objective data and not just look for the information that sort of makes you feel better about how you're feeling, because that happens quite a bit. And it can sometimes lead to faulty thinking.
We're joined by Dr. Jamie Taweel, internal medicine specialist at Grand River Medical Associates, with us on the MegaCast, talking about vaccines, talking about the increase in COVID cases here in the state of Michigan, where you can find factual information. And you should be looking, if you're doing research, at those objective sources. We have a lot of links that go to those sources on our website at civiccentertv.com/coronavirus. You can go to the Centers for Disease Control's COVID-19 website, which has additional links that can take you to some of those accredited studies that are objective, that are double-blind studies, that do have information from a number of different sources that are confirmed by a number of different sources in the medical community here in the U.S. and around the world about the vaccines, about masks, and about other issues related to the pandemic. And all of that is on our website at civiccentertv.com/coronavirus, because whether you're pro-vaccine or you're anti-vaccine or you're questioning the vaccine, you're somewhere in the middle. Going just to provaccine.com or antivax.org or whatever you're going to, you're going to get an opinion instead of getting objective medical facts. We're joined by Dr. Taweel from Grand River Medical Associates. And doctor, there's been a lot of debate also on the COVID-19 front against mask wearing, particularly for children. And because so many children under the age of 12 in particular, and really only those 12 and older for the Pfizer vaccine, are either those over the age of 12 or 12 or over for the Pfizer vaccine are eligible to get vaccinated, and every other age group of kids under 12 and those 12 and older with Pfizer, with other vaccines, with Moderna and with Johnson & Johnson, are not eligible. There's been a lot more debate about masks being necessary for kids in school, and there's, of course, a mask mandate that's in place in Oakland County. But there's also been a lot of information out there, misinformation out there, about kids don't need to wear masks because their immune systems are adequate enough to be able to fight off COVID-19 without it being a severe case for that. Why is that inaccurate? Why are masks so important for kids going back into school where some are vaccinated, some are not, some teachers are vaccinated, some teachers aren't?
Well, it's tough. I have a lot of patients that have anxiety with regards to this, that on both fronts. I have patients that are having a lot of anxiety that their children are forced to wear masks. I also have patients that are having a lot of anxiety that their children are not forced to wear masks. I actually have a couple patients that are school administrators that are kind of feeling the heat from both ends, and I want to speak on their behalf. Please don't get mad at them. They're just doing what they're told. They're trying to do the best that they can. But it can be a lot. I think that masks do help. They definitely will reduce your risk of contracting COVID-19. Are they perfect? Absolutely not. Are they user dependent? Absolutely. In other words, if you're not wearing a mask appropriately, it's not going to work. That's just the facts. I do encourage people to try and wear a mask because it can reduce the risk of COVID-19 transmission. Yes, children have better immune systems and are better able to tolerate COVID. However, they also can get it and pass it on to their parents, which can then create a bigger spread. As we are seeing, we're getting spikes in COVID cases, schools back in session, people are starting to mingle a little bit more, and things are starting to become a little bit more harried. So I would definitely encourage mask wearing. And I'll say this, it's not going to be there's studies out there that show that masks are not as effective as they were said to have been. And then there's studies that show that they are effective. My recommendation is that even if it lowers your risk by 1% of getting something you don't want, a lot of people are like, well, I'll get it and it'll be fine. My immune system will handle it. It's kind of dicey. It affects people differently. Some people get COVID and they just get a sniffle. Other people get COVID and unfortunately are no longer with us. We don't want to have that risk. Why would you take that gamble? If I told you had a 1%, even a 1% less chance of getting, struck by lightning if you did one thing, then you might be a little bit more receptive to doing that one thing. So I think anything you could do to try and reduce the risk, even if by a little bit, definitely something that needs to be done. So I encourage them to wear masks. I think that the masks will reduce your risk, won't make it zero, but it will improve things significantly. So go from there and please use, judicious thought, objective thought.
Yeah, it's a precaution. It's not forever. It may significantly help you, or it may not significantly help you, but it's better than the potential worst case scenario risk, or the worst, or the ones that are of greater risks that are involved there. And if you need to cross the highway and you have a sky bridge you can walk over, why would you walk across traffic and play Frogger with your life out there instead? It's just a terrible idea. We're joined by Dr. Jamie Taweel. He is the internal medicine specialist over at Grand River Medical Associates with us on the MegaCast. We got about 10 minutes left today, and we had a report that came through recently, an update actually from our friends over at Fox 2 Detroit, where one of our great local journalists, an excellent reporter, Erica Erickson, shared the medical reason why she has not been on the air over there over much of the last year and change. She said she is suffering from cervicogenic headaches, a common and recurrent form of headache which starts in the neck and can cause unilateral pain. And a quote from Fox 2's Erica Erickson, she said, quote, I fear I'm beginning to forget what it's like not to be in some sort of pain. She wrote in an update on her social media on Monday, said, continuing on saying, I've about had it with this burning, and I can't seem to get comfortable no matter what I do, and closed quote. So for those that have heard these reports, that watch Fox 2 or watch all of our local media outlets, as they should be mixing and mingling with different news outlets in the local area to get a full scope of journalism in the local community, and they heard about this story, but they're not medical experts. They haven't done their research, or they have done some research on it and are confused. In layman's terms, for the general public, what is cervicogenic headaches, and what does someone that's experiencing those go through?
Okay, big question. So cervicogenic headaches are basically headaches that are caused by things that are going on in the neck. So how it works is you have a set of nerves that exit the base of your skull, right? If you reach back behind your head, at the base of your skull, there's a big group of muscles that kind of split out from the center and go towards both sides and help you turn your head, maintain your head posture, etc. And in between those nerves in between those muscles comes something called the greater occipital nerve and the lesser occipital nerve. Greater occipital nerve comes from behind the neck. It goes all the way around the top of your head, and it stops roughly about an inch or two above your eye. And you have one on both sides. The lesser kind of goes a little bit more lateral around the side of the head. And for whatever reason, something sitting on that nerve will basically cause significant amounts of pain. That nerve is basically innervates the skin to the scalp as well as your head. And it can feel like someone's putting an ice pick in your eyeball on that one side if it's happening on one side, or both. This can happen from your cervical spine if you have a disc out. It can happen if you have arthritis in your cervical spine. It can happen if you're just a classic tension type thing where the muscles are so tensed up that they're actually squeezing that nerve and causing that discomfort on one side of the head or the other. And it can be pretty debilitating. I mean, I remember studying in medical school, hunched over a desk, looking down, really tightening those muscles up and getting that type of pain. And it can be pretty dramatic. So the treatment for that can be sometimes over-the-counter medications, sometimes therapy, a little bit of more detailed imaging to see exactly where the problem may lie. Some people can receive Botox injections to loosen up those muscles in the back of the neck to give some relief. And some people might need cervical surgery. Or, in Erica's case, from what I've gathered, was she was actually getting surgery to try and alleviate that by getting the nerve itself addressed, which is also a great way to fix it. But that is a pretty dramatic thing, and that burning type pain can persist and just be pretty debilitating because everything you do, it's just marred by that. You know what I mean?
Yeah, and just a few more minutes with you, Dr. Taweel from Grand River Medical Associates with us today on the MegaCast. In cases like Erica's with her cervicogenic headaches and other cases of chronic pain can be really tough to narrow down exactly what the source is and then develop a treatment for it. How much of a frustration can that process be, both for medical officials and those that are suffering? And what are some of the ways that medical doctors, like medical doctors, and that those that are primary care providers for these patients, how do they go about narrowing down and starting to treat the source of these chronic pain incidents?
Oh, that in and of itself is a huge, tough question, because first and foremost, anyone that's in chronic pain, the only thing you want to do is no longer be in it. And to sit there and go through the process of trying to determine what the cause is can be pretty dramatic. The cervical pain that Erica's dealing with is kind of like someone that has a slip disc and is getting that pain down their leg. It's just on the opposite side of you. It's up top. So that burning pain is happening up top, and it can be pretty dramatic. You have to, obviously, as physicians, our goal is to try and narrow down what it is. And we have to start kind of with the most dangerous and most immediate first. We have to ask you questions if this is going to be something that we might find out is relatively life-threatening. Chest pain, first things first, we're going to make sure it's not a cardiac issue. So as we start to narrow that down, it takes its toll on patients because it does take a little bit of time. We don't get immediate answers. People will go to the ER, and sometimes the ER may try to determine if it's something that's going to be really life-threatening and then try to get you a little bit better treated, and then to your doctor, which also delays things. And anyone that's in pain over long periods of time starts to have a lot of issues. I mean, their anxiety levels go up. It really kind of gets in the way of other things that they're doing. It can really affect their mood. It can affect their stress levels. Their hormones can be a little bit off balance just because of the chronic stress, the chronic pain that they're in. It can be pretty dramatic over a period of time. Blood pressure goes up, all of that. So the goal is to try and get that narrowed down as soon as possible. And if it ends up being an issue that we can't necessarily find or treat, then we got to get you over to pain management, where they can start to look at other ways to try and deal with things, either by addressing the pain itself through nerves. It depends on whether it's back pain or arm pain or some of these neurologic situations, to just try and do the best that we can. And it can sometimes be, like I said, it just can sometimes really impact your quality of life. And it is extremely frustrating to not be able to do the things that you want to do. And you were doing them just fine recently before this pain occurs. And now all of a sudden, this is all you think about. It's a pretty big cross to bear.
We're joined by Dr. Jamie Taweel, the internal medicine specialist over at Grand River Medical Associates. Dr. Taweel, another minute with you before we say goodbye today. Is there anything else right now that would be important for our audience to know or to be thinking about as we go forward with the COVID-19 pandemic, or generally on the medical front?
Just do the best you can, try to maintain all of the precautions. Please get vaccinated. I'm always going to recommend it. I'm not going to push or bully patients, but I will always recommend that you get it. It is safe. It does have its issues and certainly the concerns, but just talking it over with your doctor hopefully will alleviate those issues. Please discuss these things with an open mind with your physician. Don't feel like they're trying to bully you into something, but at the same time, go into it feeling like you're not going to be resistant to any recommendations. Please take them, consider them, do some independent research that is objective, and hopefully come up with some reasonable answers that will be for the better of you and the community around you. And also, above all else, please don't forget about the rest of your health. There's still other things that you got to keep in track of. So, please make sure you're getting your, I've gotten a lot of this year, not to ramble, but a lot of patients that, I didn't get my mammogram last year because of COVID, I didn't want to go into the hospitals, and that's understandable. But don't let that stuff slip to the wayside too long, because you don't want to get blindsided by something else the entire time you were staring COVID directly in the face.
Well, Doctor, we appreciate your time. Thank you for your insight, and thanks for being with us again.
Oh, I appreciate it always. Thank you so much for having me.